This presentation today on Grandma Won't Brush, Daily Oral Care for the Frail Elderly is really geared for three groups of people. One would be you, the family caregiver who is taking care of a loved one. Could be a spouse, it could be a relative. The other group of people that this presentation is geared towards is for the professional caregiver, whether you're a certified nursing assistant, whether you're a caregiver for a personal health service or a personal care service company, or if you work for an assisted living or you're a nurse. The other and final group that I hope will be able to watch this presentation either now or in the future would be the dental hygienist, who I think has a role that is truly a role in the future that we haven't quite utilized yet. And I think the key, one of the big keys to making a true difference in overcoming the barriers innate in providing daily oral care is through the dental hygienist expertise and role. So one of the main themes that I would like to present today is that there is no cookie cutter approach to providing efficient, adequate daily oral care for the frail elderly. These women, although they look much alike, have completely different needs, and those needs are based on, one, their ability to cooperate or not, two, on their ability to participate or their dexterity limitations, and three, on what their relative aspiration risk is. For example, the lady on the left had moderate dementia, but she was actually very actively participating in her dental care, but she was also an aspiration risk. The lady on the right, who was 100% cognitively intact, was unable to help at all with any of her daily care. So if we take a cookie cutter approach, we would not be able to give these two residents what they actually need. So hopefully by the end of this presentation you're going to see that we cannot just take a cookie cutter approach, but we have to look at each case individually. For the purposes of this presentation, we are going to look at the frail elderly as individuals who are functionally dependent on others, to the point that even basic daily oral care, which actually sounds simple, but will be complicated in a regular setting, whether it be in a nursing facility or if you're caring for a loved one at home. I know that if you don't provide daily oral care for individuals on an ongoing basis, it may seem deceptively simple. But I want to assure you, for those who do, that there's a lot of barriers that you really don't think about, and barriers can change from day to day. I'm reminded of yesterday when I went to a nursing facility and I had to follow up on a patient of mine, and every time I had followed up in the past, she was sitting in a Jerry chair or sitting in a wheelchair, so it was quite easy on me to provide the follow-up care. But yesterday when I went to see her, she was laying in bed, she was curled up with a blanket around her, and all of a sudden things were turned upside down, and I had then to change how I normally would go about providing that care. Because when you are bedridden, the systems that you used before obviously will not work. In fact, one of my main points today, and those of you who do provide daily care will appreciate this slide, and that is that the difficulties are really underestimated. And if they weren't underestimated, then I think we would have daily oral care less of a hit and miss. I've been doing geriatrics exclusively for 12 years. I go to a lot of facilities, and I can't say that, that there's not a concern, but I can say at best daily oral care is hit and miss. And that is for a number of reasons. If you're a caregiver of a loved one at home, you'll know that lack of time can be truly an issue, or if you're a certified nursing assistant. Another one may be lack of motivation. And I don't mean motivation in terms that you don't want to provide the care, but sometimes you can be so overwhelmed with other competing needs of the frail elderly that you may be less motivated to provide the daily care and more motivated to provide what may seem like a more immediate care, like perhaps toileting the frail elderly person or feeding the frail elderly person. The other problem that I see quite frequently, if we take a cookie cutter approach, is that the right supplies are not available to provide the daily care. And by the end of this presentation, I hope I can open up some of your eyes as to what some of the choices are out there, because if we're routinely just thinking of toothbrush and toothpaste, I can assure you we're making the job more difficult not only on us, but on the frail elderly who can benefit from this daily oral care. So there's a lot more tricks and supplies and things that we can use that will make our job not only more efficient, but it will make us more effective.